Hello, my name is Dylan Hofmann. I am a student in the Indiana State DAT program, class of 2021. In this video, I want to kind of talk about the domains of athletic training and how we can take our practice from those to a more integrative approach. In the last 2 semesters of the DAT program, the Doctorate of Athletic Training, we've looked a lot at integrative practice and being an integrative, holistic healthcare provider. And what that means. Before we dive too far into that, I want to kind of look at the domains of athletic training as they currently stand. And maybe we can kind of talk about how athletic trainers perceive these domains and how we can change that perception moving forward to be better providers. The domains, when you look at them on the BOC, injury and illness prevention with wellness promotion, examination, assessment, diagnosis, immediate and emergency care, therapeutic intervention, healthcare administration and professional responsibility. What you'll notice a lot of times with athletic trainers is that they actually look at these different domains as separate entities and they don't connect them together. You'll often find an athletic trainer that may say, oh, I'm really into therapeutic intervention. I love therapeutic intervention, but I'm not a big fan of evaluation and examination. Or you may say an athletic trainer is like, I'm really into injury prevention and promoting wellness so that people don't get hurt. But I don't really like to document and do some of those administrative duties. Again, you may see an athletic trainer that says, I'm really into immediate and emergency care. I love taking care of those people, but like long-term rehab, just not really my thing. And the truth is you can't separate these. And when we do separate these, we're practicing as a clinician. I'm saying these are the skills I like to do, right? If we separate these, we are practicing based on ourselves. We're practicing based on our own enjoyments or those sorts of things. And we're not practicing on what truly matters, and that's the patient in front of us. So to move from a clinician-based practitioner to a patient-based practitioner, we have to be able to integrate healthcare holistically. What does that mean? What does it mean to integrate, right? The simple definition is taking parts and putting them together as a whole. And that's all the domains are. The domains of athletic training, prevention, assessment, emergency care, therapeutic intervention, healthcare administration, they're all just parts. And if we're going to provide holistic patient-centered care, we have to be able to take these parts and put them together. We have to find the commonality that connects all of these. Something that's really interesting, and I think the way that we as athletic trainers can connect these dots and these domains is through something I've seen that's common, a common thread within all of them. That is evidence or best practices. When you look at the definition of every domain, it mentions something along the lines of using the best evidence or using best practices. Evidence-based practice is how we're going to move forward. Right? Evidence-based practice is taking what the data says, what we can see through our research, our experience and the way that we've been practicing, and the patient, and what the patient's values are, what the situations and experiences and goals of the patient are. And if we can take all 3 of those together, then we can practice truly evidence-based practice. And what you'll see is when you do that, all of these domains fit together. And you actually run through each of these on their own as a whole instead of individually. We shouldn't simply dissect and divide these domains. Your assessment links directly to your therapeutic intervention. Right? Your professional responsibility, healthcare administration, is linked to the injury prevention, right? All of these things come together in emergency immediate care. When a patient gets hurt, they're going to go through all of these domains, right? We want to provide care that keeps them from getting hurt. We want to be able to take care of them as soon as they get hurt, even if that is an emergency. We want to be able to accurately assess and diagnose, and we want to do so in a way that's going to set us up to choose the best interventions and best treatments. And then moving forward, we have to be able to look at ourselves, at our professional responsibility, be able to document the progression, document patient outcomes, and truly see, are we making a difference? Is our practice working? We have to be able to look at that and collect that data from our prevention, assessment, care, interventions, and we have to see, is this working? If it's not, where are we going to make a change? How are we going to shift our practice? And if it is working, what's working about it and how can we improve that? A couple examples we've gone through in this class. One that really stuck out to me was, and luckily this was something I had some previous practice with before, but treatment-based classifications. Performing my assessment and examination to determine what's the best intervention. And it takes a lot of pressure off an athlete trainer because I'm no longer just focusing on, am I going to get, is it this pathology or this pathology? At the end, it doesn't really matter if I've used best evidence to select interventions that help with what I'm seeing in the patient, right? What limitations do I see? Is the patient hypermobile or are they hypomobile? And then choosing interventions that are going to best help that patient. Documenting that and measuring it so I can see, am I actually being effective? Another awesome assignment that we looked at, and going off of that, something I even noticed when I did an SP the other day, I got the assessment wrong. I did not identify the best pathology, and after some reflective experience in that, I realized I got it wrong. Yet I was still able to place that patient in a treatment-based classification that was still the best for them. So did I miss the specific pathology? Sure, I did. Did I choose interventions that were going to help that patient? Absolutely. I was able to practice better holistic patient-centered care because I looked at these domains and I put them together. Right. Another assignment is comparing treatments of MCLs and lateral ankle sprains, grade 1 sprains of both of these, and being able to look at those and combine them together and talk about what are the best ways we can prevent this injury from happening again. What's the best way to assess this, to take immediate care of it? What's the interventions? What's the best way to document and have outcomes that say, are we able to put this athlete, for example, back into play? And what I found is it's essentially the same. When you looked at these domains holistically, these two injuries aren't that different from each other. That's just another example of ways that integrative holistic approaches to healthcare can help us be better practitioners. And the only way we're going to do that is if we continue to look at our patients' values, experiences, and goals. If we look at our own experiences, such as mine, through practice, through our knowledge, etc., and we're able to look at the best practices, what the evidence says, finding new techniques that we've never even heard of before, and taking all of these things and mashing them and mushing them together. And what it creates is better healthcare that's patient-centered, not clinician-centered, and helps us truly help our patients. And that's where athletic training needs to go. Luckily, I think it's on its way. And through this doctorate of athletic training, I've been able to walk further in that step and truly understand what it means to provide integrative health, holistic health for a patient. And I look forward to helping this profession move further in that direction, away from simply looking at the parts and picking the parts that we think we're good at or that we want to be good at, and saying, instead of being good at examination or intervention, I can be good at all of it. And by being great at all of it and using evidence-based practice, I can become a better practitioner for my patients. So thank you for listening. I hope this was informative, and I look forward to speaking again.